Hi, class. Hopefully Monday wasn't too traumatic with the snow, and let's look forward to spring. Today we're going to talk about strokes, and we're going to talk also about choking. And we'll also, when we look at the choking process, how to handle it, we'll look at a person that's also um, unresponsive. But first about strokes. Um, Strokes are the third leading cause of death in the United States, approximately 800,000 a year. The one thing about a stroke, if you can identify it quickly enough, there is the possibility to um, prevent damage as well as even reverse some of the damage. And when we think about the damage occurring is, the blood that's coming into the brain, either it's bleeding, and there's some major issues here that could happen. So when we think about what causes a stroke, genetics, if it's a family history, um, some risk factors are your diet, changes in lifestyle, medications, um, previous strokes or mini strokes, and of course, when we look at the main cause is age, gender, family history, um, are some of the key factors. Very similar to heart disease. So, class, let's look first at, we'll bring this video in, and I'll minimize myself so we can get the video on. Pull it over, maximize this, and we're going to look at strokes today. Let's pan down, or up, I should say.
A stroke is caused when blood flow to a part of the brain is cut off or when there is bleeding into the brain. Strokes can lead to permanent brain damage, but sometimes the damage can be stopped or reversed. If you suspect a person is having a stroke, try to note the time it began and call 911 right away. How do you find out if a person might be having a stroke? Think FAST. That stands for face, arms, speech, and time. Ask the person to smile and check the face for signs of one side drooping. Have the person lift both arms and check to see if one arm drifts downward. Ask the person to say a simple sentence, such as, "The sky is blue." Check for slurring and whether or not the person was able to repeat the sentence correctly. Try to determine when the symptoms began. Time is critical. Call 911 or the designated emergency number right away if you believe a person is having a stroke. And remember, all you need is one sign, the drooping smile, the drifting arm, or the slurred speech, to call 911.
Okay, so I'm going to pause right here. So the acronym FAST, one more time, and this is critical with a stroke because if you react within a few hours, there is a good chance that you could save the victim as well as a possibility of reversing any damage that may have happened. So the face or smile with the F is drooping. So when you look, you'll see in the face just to, tell them to smile or see what and how that reaction works. The arms, have them lift the arms up, and you'll see if one again is one may drop, and that's another factor. And then, of course, have them say, what's the temperature today, or just have them say a short phrase. And if their speech is slurred, that's a significant sign. And of course, the T is time, how fast you can get the person help. So again, that acronym FAST is a critical piece to handling a person with symptoms of a stroke. Some things that also may cause, I want to mention about blood pressure is one of the key factors. If you know your family has a history of high blood pressure, or you may have, or might be your grandparents or parents, make sure that that's controlled. And that's a big factor through diet, exercise, and of course, medication. So that's what we're talking about stroke. And our next situation we're going to deal with, we're going to go right to, and we're looking down, and we're going to look at a choking adult. And this will be a person that's responsive. Here we go.
Choking is a common breathing emergency, and it occurs when a person's airway is blocked. If the person is unable to cough, speak, or breathe, you'll perform 5 back blows followed by 5 abdominal thrusts. Doing these 2 actions in a cycle will help dislodge whatever food or object may be blocking the airway. Your body position is very important for effective back blows. Stand to the side of the choking individual with your feet about shoulder width apart. Turn your body towards the person and place one arm across their chest, like this. Bend the person at the waist and use the heel of the hand in the center of the upper back, right between the shoulder blades. For abdominal thrusts, stand behind the choking individual. Make a fist with one hand, with the thumb facing in towards the person's stomach, and place the fist against the person's torso, just above the navel. Grasp your fist with your other hand and bring it in and up in a swift movement into the person's abdomen. If you are unable to reach around the person's abdomen or the person is pregnant, give chest thrusts instead. Give chest thrusts in the same place you would for CPR, in the center of the chest on the lower half of the breastbone. Continue this cycle of 5 back blows and 5 abdominal or chest thrusts until the object is forced out, the person is able to cough forcefully, talk, or breathe, or the person becomes unresponsive.
So the summary here, there is one factor. Some courses will not, and some situations. The American Red Cross, as you just viewed, does back blows as well as abdominal thrusts. And that is not always the case. Sometimes people feel that with the back blows, you might lodge it down, get more so caught further into the throat area. So let's look at this brief summary. Make sure you watch, and we're going to go through now the skill practice. Here we go. I believe I just have to get myself out of the picture. Okay, so we'll start the mission.
It looks like Melanie needs your help. Time to step in and take action. Before you help her, however, you need to...
Sorry there. You pause. Oh, yes, class, I'm just going to get the volume on now.
It looks like Melanie needs your help. Time to step in and take action. Before you help her, however, you need to make sure the scene is safe.
So we always check again, check call care, as we always know.
There doesn't seem to be anything dangerous on this side of the room. This side of the room doesn't appear to have any hazards. Good work. You've checked the entire scene for hazards and determined it is safe. While checking, you didn't notice any severe life-threatening bleeding. When providing care for a choking individual, you need to make sure the person's airway is really blocked and no air can pass through. If the person can cough or breathe, encourage them to continue coughing forcefully. If the person cannot breathe, cough, talk, or make sound, like Melanie here, send someone to call 911 and bring an AED and first aid kit, obtain consent, and then begin providing care right away.
So this person's a bystander. I'm going to send, this is Claire. We're going to send to call 911.
Okay, I'll be right back.
Good work. During a choking emergency, it's a good idea to send someone to call 911 and get an AED. This way, you can use the AED right away if the person becomes unresponsive. Since she can't breathe, speak, or cough, Melanie will need back blows and abdominal thrusts. Select Melanie to obtain consent, and then begin providing care right away.
Okay, so we need to obtain consent. One thing you did here and there about CPR and the AED, that's going to be a 2-week process when we start the CPR and working with the defibrillator. So let's gain consent.
What should you say to Melanie? That's correct. Before you help Melanie, you should obtain her consent to help. Now, what should you say to obtain consent?
Okay, so we look through this process. What level of training? Okay.
Nice work. In a choking emergency, obtaining consent might sound something like this. It looks like you're choking and can't breathe. I'm trained to respond in breathing emergencies, so I'm going to do a series of back blows and abdominal thrusts to help you. Is that okay? Now that you've obtained consent, begin providing care right away. Drag the correct hand to the correct spot on the back to prepare for back blows.
Okay, so we look here. We pull this over.
Not quite.
Not quite there.
Place the heel of your hand in the center of the back, between the... That's correct. Now you're ready to give back blows. Press the back in the correct spot to give a back blow. When you've completed 5 back blows, select the Done button. Nice work. Next, move on to abdominal thrusts.
Okay, I called 911. They'll be here soon.
Okay, we're going to go to abdominal thrusts. Oh, my bad.
Drag the correct fist to the abdomen. Then cover the fist with the correct hand.
Okay, so when you think about this, putting the thumb in, turn them.
Not quite. Make sure the thumb side of the fist is against the person's abdomen, just above the navel. Not quite.
There we go.
To give effective abdominal thrusts, make a fist with one hand and place the thumb side against the middle of the abdomen, just above the navel. Then cover your fist with your other hand. Press the abdomen in the correct spot to give abdominal thrusts. When you've completed 5 abdominal thrusts, select the Done button. Good work. The abdominal thrusts have freed the obstruction, and Melanie is able to breathe again. She's a little shaken up, but she's going to be fine. Nice job.
Okay, let me pause. Okay, so the next thing we want to look at is a choking adult that becomes unresponsive. The one thing I do want to mention is that the CPR aspect and working with mouth-to-mouth and CPR, which is in CPR, and working with the AED, as again, we will work in that starting next week and the following week. We'll have 2 weeks working with CPR and working with the AED. That's one of the biggest pieces of information coming out of this course. But I do want to show you with an unresponsive choking adult what to do. And in the same process, just say you were never trained, you'll have enough information that you can think about using CPR. And remember, the Good Samaritan Act, if you can get chest compression, I mean, that's the key ingredient, even more so than the mouth-to-mouth. So let's look here, and we're going to look at an unresponsive adult and what to do with choking.
When back blows and abdominal thrusts aren't enough, or a person's airway has been blocked for too long, a choking person might become unresponsive. If this happens, you should carefully lower the person to the ground, making sure to support the head and neck. Once the person is on the ground, start CPR right away, beginning with 30 compressions. As you open the airway to give rescue breaths, look in the person's mouth for any visible blockage. If you can see the object blocking the airway, use a finger sweep motion to remove it. If you don't see the object, do not put your finger in the person's mouth. Just continue CPR. Remember, never try more than 2 rescue breaths during 1 cycle of CPR, even if the chest doesn't rise. Continuing a cycle of 30 compressions and 2 rescue breaths is the most effective way to provide care. Even if the breaths don't seem to be working, compressions may help clear the airway by moving the blockage in the airway up to the mouth, where it can be removed.
Okay, so the brief summary, if you can look through that, we will have a quiz that follows this video. The video segment will be about 14 minutes. If you have any questions, I always reference, please email me. And if you miss a quiz, let's get this out of the way. I don't know what that came on. If you miss a quiz at any point in time, as you know, that's also part of the grading system, attendance through and via the quiz. So please email me, and I wish you all the best, and good luck on the quiz following this. Take care, everybody. Stay safe.